Welcome to the Body Ethos Podcast, where we're shifting the culture from sickness to health. Before we dive in, please remember that this podcast is for educational purposes only and is not a substitute for medical advice, diagnosis, or treatment. Always consult your healthcare provider before making any changes to your health routine. Hello, everyone. Welcome to the Body Ethos Podcast, where we're all about shifting the culture from sickness to health. I'm your host, Jessica Whitmill, and today we're diving into a very interesting topic of low dose naltrexone, LDN, and its transformational potential in addressing autoimmune conditions, chronic inflammation, and more. Today's guest is Alexandra Armstrong, and she's here to share her expertise on low dose naltrexone, also known as LDN, and how it can be used off label to address autoimmune conditions, chronic inflammation, and other health challenges. We'll also dive into her personal health journey with her family using LDN, including how it helped her and her daughter, and explore why this versatile treatment is becoming a powerful tool in the world of integrative health and medicine. This conversation perfectly aligns with our mission to uncover the root cause of illness and empower you on your healing journey. So let's get started and dive into this life-changing discussion. Alexandra, I'm so glad that you're here with us today. Can you tell us a bit about yourself and how you got into this healing work?
Yes, thanks for having me. Like many of us in this field, I came into it because of my own health struggles. I became a nurse practitioner and I saw a huge gap in patient care. And I also felt underserved as a patient myself navigating my autoimmune disease. And I felt that there was more to be done in regards to diet and lifestyle. And my doctor was telling me there's nothing you can do. And I just didn't believe that was right. And especially about halfway through my nurse practitioner program, I decided to explore functional medicine and then ended up starting my own practice after graduation.
I love that. Yeah. I think so many of us come to this field from frustration and knowing that there's a better way. And it's like if there's not a better way, like let's just create a better way. So I love that you took that path with your nurse practitioner program as well. We need more people like you with those advanced degrees in this field and forging the way with functional medicine. So I know low dose naltrexone is something that you talk a lot about on your Instagram page and utilize with your patients and even with your family. Can you explain what it is, how it works, and why it's gaining attention in the functional and integrative medicine world?
Yeah, so low dose naltrexone was discovered in 1984 and is currently licensed for both opioid and alcohol addiction. And the typical dose for naltrexone is 50 to 100 milligrams. But in 1985, Dr. Bihari discovered that lower doses could help stabilize the immune system. And he discovered this by accident when he was working with HIV patients. And so since then, there's been more and more studies on using it for MS and using it for Crohn's and using it for mast cell and now long COVID. So it's really gained a lot of attention in recent years. And I know I was introduced to it in 2019 by a functional practitioner. And then I actually wrote a paper on it in grad school. So I still am learning more and more about it. And that's what's so exciting about it is I think the longer it's around, the more we're going to use it.
Absolutely. Yeah. So I think that's cool too. Like, that discovery that was made in the 80s. And now we're finding like there's so many additional uses for it. Like you're saying, like not just autoimmunity or MS, but now long COVID because of its inflammatory nature. So I love that. And I didn't realize you wrote a graduate paper on that. That's so cool. What was
Yeah.
your focus of the paper?
It was just really telling about LDN, what it is and how it works. And I know my professor was like, wow, great paper, very interesting. Because I don't think it was really ever something they would probably use in their own practice. And I have had a few clients I see without my license, that they're seeing a PCP and they have had great, their PCP has actually been like, yes, I'll write it. And then I have other people, they bring it up with their PCP and they're like, no, that's for, addiction. We don't use that. And so it's really awesome to have, those people that are aware of it and how to use it. So yeah, it was mainly, the paper was just on, here's what it is, here's how it's changed my life. And so, yep.
I love that. Yeah. I think that that's something maybe we'll talk about too is, there are some providers that are really open to it, and there are really great internet resources where you can find a provider. But two, I think the cool thing is like educating your provider on it as well and bringing them, that evidence, and maybe that can also help other people in their practice. So I love that you brought that to your professor's attention. Who knows? Maybe he's lecturing on it today. So, you prescribe LDN off label for conditions like autoimmune and eczema and chronic inflammatory conditions, and obviously long hauler syndrome with COVID. Can you share how LDN works to address these issues and makes it such a versatile tool?
Yeah, so it is very versatile. There's a lot of nuances in the dosing, and depending on the dose, it's going to work a little bit differently. So we have a very low dose naltrexone, and that would be starting at zero point 0.1 milligram, and that would be used for chronic pain, and you would just titrate your patient up until they're like, my pain's better. And then you have low dose naltrexone, which is probably the most commonly known one. And that's anywhere from like zero point 0.5 to 4.5. And that 4.5 was not like a scientifically studied. It was just like halfway between 9. And they're like, oh, this is going to be the average dose now. And then at about 6 or 7 milligrams, it goes from immune balancing to more immune suppressive. So it depends on kind of what you're going to use it for, where you would dose it, but it really works in two main ways. In one way, it's blocking opioid pain receptors. And then in turn, that's going to have your body create more of your own opioids and help with pain. And so it's going to create more endorphins and help you control your pain. And then it's also going to bind to receptors in the immune system and stop the production of certain molecules that trigger inflammation. So if we think about Th1 immunity, which is more autoimmune, and we think about Th2, which is more allergies, and we think about them on a balance beam. If we have autoimmunity, we're more lean towards the Th1. Well, LDN is going to go in there. It's going to block Th1 to some degree, and in turn, that's going to balance out the immune system a little bit.
Yeah, that makes so much sense. So for people who are needing more of that pain management or autoimmune, it can be at that super low dose, right? I mean, that's why it gets the name low dose naltrexone, and it works in different ways. And like you're saying, you can titrate up to find your perfect dosing. So it does take some time to kind of tweak, it sounds like. But also then you get to a point and it kind of changes in nature what it's doing, right?
Yeah.
Awesome. Yeah, absolutely. I love that. And I know too that you've used LDN personally for yourself and your daughter. I was wondering if you could maybe share your story and how it supported your family's healing journey.
Yeah, so in 2019, after years of trying to figure out what's going on with me, why am I still feeling fatigued despite saying, going to endocrinology and going to GI and then being like, yeah, you have IBS. Yeah, you have hypothyroidism. I'm like, there's got to be more I can do because all my labs look like okay to them. So I saw a functional provider in Omaha, Nebraska, and she was like, I want to put you on this LDN. And she was explaining what it is. And she was telling me, it's going to help you feel better. It's going to give you more energy. You're going to have more mind clarity. Because I was really in a bad spot in 2019. And she explained to me, I started this on my son and he's very healthy, and we started very low and worked up. And so that's exactly what she did for me. And at one time I was on as much as 9 milligrams. And then I came down to 4.5 milligrams and actually took that all during my pregnancy and breastfeeding with my daughter. So I've just kind of hung out at the 4.5 personally. And then for my daughter, around 6 months when we introduced solids, she started to get some eczema on her cheeks. And I was a little concerned that she was having some circulatory issues. And then at 1 year, the pediatrician was like, yes, she does have Raynaud's, which is an autoimmune condition. So that's when I was like, okay, let's just bring in the naltrexone because it's helping with the inflammation. So any patient I have that has inflammation, I'm going to consider it. So for her, again, I started very low and just worked up. And right now she's on about 1.25 milligrams. So you calculate that the same way you would calculate other pediatric doses based off their weight. And then with my husband, he's had COVID several times, and this last time he had some lingering fatigue and an exercise intolerance, just not feeling like himself. So we brought out naltrexone, and honestly, within a day or two of starting that along with other therapies, I was like, your energy seems way better, you know. And
Yeah.
he's not by any means 100% like cured or back to normal, but he's like, he can function, he can go to work, he can think, and he can make it through the day, you know, and you can tell he's not just feeling terrible all the time. So um and we have him on 4.5 milligrams as well. So that's typically like where you get to, but that's not a magical dose. So if you start somebody and they get to like 1.5 milligrams and they're like, you know what, I'm not feeling the greatest, like I'm kind of like too turned up, you know, that's how I explain it, is you're going to feel like a lot of energy but not in a good way, then we can just back them down to 1 and kind of hang out there, and then later on we may try and up them again. But just because they're not at 4.5 milligrams doesn't mean they're getting benefit from the medication.
Yeah, that makes a lot of sense. And I love how, like, there's different case studies here where you had this chronic fatigue, your daughter had the eczema and the radons and the autoimmune kind of brewing, and then your husband had the long haulers, and it's helped all of you and your family. And like you said, it's not like a silver bullet and by any means, but it can give you that energy, that mental clarity to then do the work with those deeper root causes. And that's why I think it's really exciting, right? It can be that really missing piece of like, okay, let's start here, and then we can really work on those deeper layers, as I know you're doing with your family and your husband and yourself, right?
Yeah, and actually for cancer, it's really awesome. So it works and makes chemotherapy work even better. So if you're
Mm.
chemotherapy, it's useful for that. And in oncology, you always want to cycle on and off. So that goes into that nuance of like not every patient you're going to give it the same way. So for someone with cancer, you would cycle it like 3 or 4 days on and then 2 or 3 days off. So you could just have them take weekends off. And the other thing about naltrexone is not everyone like takes it and they're like, wow, in a week I feel like amazing. But I typically say, like, let's hang on it for at least 3 months. And sometimes it's them saying, hey, like, I'm paying for this, I don't know that it's working. Then they stop it. And then they're like, oh, yeah, actually, I felt like better on it. Because it's kind of working in the background. And like you said, it's going to work better if you're addressing those underlying root causes too, alongside of it. It's not just the one thing that's going to fix it all. It's going to be an adjunct to other things that need addressed.
Yeah, absolutely. I didn't realize that some people are using it adjunctively with cancer treatments. That's really cool too. Um, and yeah, I have a family member that has used their low dose naltrexone LDN, and it was a game changer for them with their chronic health conditions. But they had a similar situation where it was over 3 months. They really noticed like these small little changes, and then they kind of tweaked the dose or went off of it. I can't exactly remember. And then they realized like how much of a difference it really was making kind of on the background, like you said, like kind of improving day to day pain and symptom management, which they didn't realize that, because it was so subtle, but like really impactful. And now they're like, this is my number one thing I want to be on because I feel so good. And then sharing it with others as well. So I think it's really cool. So yeah. And yeah, like you said, it's not getting to the root cause, but it can help you in the moment when you're really at kind of that like wit's end of what to do, and give that body the boost it needs so then you can have that energy to, do your castor oil packs and eat healthy and move your body and things like that. Where before maybe you didn't have any of that energy at all. So I think it's really powerful in that way. Yeah, absolutely. I would love to hear maybe some case studies or just some results that you've seen in some of your patients that use LDN.
Yeah, so sometimes, like I've said, we start it and they're like, not really notice anything. I'm paying for this, So I'm like, okay, well, you're your own doctor. So if you feel like you want to stop it, I'm okay with that. And they stop it and they're like, I think I felt just slightly better on it, a little bit more energy,
Mm-hmm.
less pain. But then I've had where I have someone come to me, they're taking Tylenol every day, they're taking ibuprofen every day, they're taking Flexerol, and their pain's like 7 out of 8. It's a struggle for them to get out of bed in the morning. we start the naltrexone, we work on root causes, and then now they're taking no Flexeril, they're taking no Tylenol, they're taking no ibuprofen, then their pain's like a 2 out of 3 versus a 7 out of 10, and they're still on the naltrexone. And it is really something you can continue indefinitely. I've also had people where we start it 1 month, they come in the next month, they're having this terrible hand pain, and I'm like, how's it going? They said, oh, it's going. I'm like, is this going to be good or bad? They're like, my pain's completely gone. It's awesome.
Yeah.
So sometimes you get amazing results, and sometimes you just know, like, okay, my patient has these things going on, so it's going to benefit them. They may not see like a huge difference, but you just have to know it's in the background working. And of course, if someone's like, I just don't want to pay for it, and I'm like, okay, well, here's, what it's doing for you, and then let them make that decision. But it is, the results have been kind of broad spectrum, and my daughter, she still has Raynaud's, and her eczema is like way better. It's, you can tell like maybe she has something, but she has no flares. Her skin's not irritated. She just looks like a normal kid. But for me, I'm going to continue it because I'm like, well, there's the autoimmune aspect. And so I don't want that to cascade into other autoimmune conditions. And so we'll keep that on going for her, probably ongoing. And then when she becomes an adult, she can make that decision on if she wants to continue or not with that.
Absolutely. Yeah. Like you said, it can be such a good long-term tool for some people. I know there's still research coming out, like you said too, about like what are the long-term, benefits of being on LDN. Like we know a lot of short-term, we know a lot of, but maybe there's some really cool long-term things that we haven't even discovered yet, because it's not been around that long. So
Yeah, I know my mentor, Dr. Anderson, he just recently had a webinar, and he's like, hey, this is an update for LDN because we thought it was working in this way, and it's actually, we found out now it's working this way. So that down the line, they're going to figure out more. And I think everyone's like knows we don't know everything about the human body. So as we continue to learn more about that, we're going to understand more about how those things we're taking are working.
absolutely. Yeah. Which is so fun and cool. I mean, just the functional medicine space is always evolving and changing. I know listeners might want to know, are there any potential side effects or risks for people who are going to consider taking LDN and who might also be a good candidate for this type of therapy?
Yeah, so if someone comes to me and they have any complaints of chronic pain, they have any autoimmune condition that we know of, or they have cancer, I'm going to consider it. And I'm going to bring it up probably at the first appointment and say, here's this is available. Here's what it does. Do you want to think about it? Would you like to start it now? So those are the main conditions I consider it for. And then when we're starting it, I'm very cautious, and that's just how I was trained. A lot of providers, like some that work in rheumatology, they'll just start at 4.5. And if their patient has a side effect or they feel terrible, they're like, well, it didn't work for them. Other providers will start at 1.5 and go to 3 and then go to 4.5. I've always started at 0.5. And if I have someone I think is really sensitive, I will actually get the pediatric liquid and start even lower than that. And since it's in a bottle, it gives you the ability to titrate it easily, instead of getting different capsule sizes. And you can actually dose it topical too for even sensitive people as well. But the side effects are mainly vivid dreams. It can interfere with sleep. So initially, everyone was told, like, start it at night. And then you may have insomnia, you may have vivid dreams, and that usually goes away in 3 or 4 weeks. I started prescribing it like that, and then now I more just have people start it in the morning, so we don't have that interference with sleep. And then start at the really low dose and work up. The other thing that people have had, and it's been pretty seldom, has been like a slight headache. And again, that usually goes away after a couple weeks. And that's very uncommon. And then the other thing to know about LDN is because of how it's used at higher doses, you would not want to take it with alcohol. Like if you're going to drink that day or have a glass of wine, don't take your naltrexone. And then also if you're on any kind of narcotics for pain, it could potentially make them not work as well. So it's maybe not as much of a problem if you are starting the naltrexone, then starting the pain medication. But if you're already on pain medication, it could potentially block that and you're going to not have your pain control. So you could probably get away with taking your naltrexone in the morning and having a glass of wine in the evening. But if you just know you're going to drink that night, I would not take it because it can cause nausea and vomiting.
Okay. Okay. Yeah, that's great to know. I mean, I think that overall, though, I mean, as far as a medication, the side effects seem pretty minimal for the potential gain that you get from the benefits, right? But I really loved you kind of going into some details for people because who knows, their providers may not even have told them these things, you know?
Yeah, and I think that's part of why it's gaining so much attention is because it is more understood now. It's very safe. Side effects are not very many, and it's not very expensive. Like in comparison to other things, when you're starting someone out on a taper, you're going to have a whole bunch of these capsules. So that's going to be more expensive. So it's usually around like 110 per month, depending on the pharmacy. But once you get to your like 4.5 or 3 or whatever your dose is going to be, it's around like $45 to $55 a month. So, it's not super cheap, but it's also not extremely expensive. It does come from a compounding pharmacy. So, if you go to your doctor and you're like, hey, can I get some low dose naltrexone? And they don't really use compounding pharmacies, they may look at you sideways and be like, I don't even know what that is. So, it's kind of depends on the provider, how comfortable they're going to be, sending into a compounding pharmacy or not. But it's not available commercially, like from Walgreens or CVS. You're going to have to get it from a specialty pharmacy.
Okay, that's good to know too. As far as like, especially knowing that, having those conversations with your provider, if they're comfortable with that type of prescription or not as well. So it's good to know. And some people may not have a compounding pharmacy in their town, but I know a lot of times you can send off to one that's not local and they can mail it to you, correct?
Yeah, so I actually live in a very small town, and then my practice is in another small town, but there's not a compounding pharmacy in either town. So I will call it into my pharmacy in Omaha, and they will ship to most states. And then I have a couple other places that will ship to like all 50 states. So, yeah.
That's awesome. Yeah. So there's hope. Like if you do live in an area where there's not a compounding pharmacy, you can still get access to this type of, treatment if you need it. There was another question that I had for you. I know that as we've talked about, there's a lot of growing research and interest. How do you see LDN evolving as a treatment, both in conventional and integrative medicine spaces?
I think it's going to continue to gain traction and popularity. And I think what we're doing today and spreading the word and just having people know about it so they can bring it up with their provider, or if their provider says no and they're like, oh, okay, now I need to find a new provider that's more open to this. I think that's just going to help us to have more people using it. And then because more people are using it, we're going to learn more about it and how it works and how it can help other conditions. And I think one thing that's particularly been really interesting to look at has been the whole long COVID thing and how it's been such a helpful tool to have. So I think it's just going to be exciting to see how much more we learn about it and how much more it can help people without having all those side effects that other medications have.
Absolutely. Yeah, I agree with you. I think, not only just with the rise of autoimmunity, but now this long COVID kind of symptomology, I think anything we can do to support the immune system in the body to get into that healing state is really amazing. And a tool like this could be, a really amazing game changer for people. And I can't wait to hear even more research about like cancer treatment. And who knows, maybe it's also good for cognitive decline. I mean, who knows what type of research will come out. I don't know if there's any areas you've been looking into recently around this, but I know the long haulers is one that's near to your heart with your husband.
Yeah. I do have a patient on it for Parkinson's, and they're kind of in the camp of, I don't know that it's helping me a ton, but they did come off it and they called me and they said, hey, just want to let you know, Alex, I did come off of that. And just like you said, I think I was feeling a little bit better on it.
Hey.
So you can actually go on ldnresearchtrust.org, and that's one of my favorite resources to send patients to because they have videos. And if you have cancer, there's a video for that. And there's a video on how LDN works. they actually have a condition list where you can put your condition in and search. Then it's going to show you all the articles that would say if LDN is going to help or not. And then they also have those listed out in categories from like dermatology, cardiology, as well as they have a provider list, which I am on, that you can search your location and see if you can find someone that will write for you. And they're always updating that with new information. So it's a really great resource to look at as a provider and then also as a patient.
Perfect. Yeah, I'll definitely link that in the show notes. I was going to ask you, how could people work with you for LDN if they're interested?
Yeah, so currently I'm only licensed in Iowa as a nurse practitioner. So if you see me in person once per year, I can write a prescription for you. So that would be the way to obtain LDN from me as a provider. I can't write it for anyone that's out of state that hasn't seen me in person once per year. And I do have people that come from other states and just see me once per year, and we can do whatever you need. We can do hormone replacement therapy, we can do thyroid medications, we can do LDN along with all the other functional tests and things I do. So that would be the best way to work with me.
Yeah, perfect. So if you're in the Midwest, you're willing to make the drive, Alexandra is awesome for that. And then, of course, I'll link in the show notes the LDN provider list, and you can find someone local to you. But I know too, like this family member that I have, they just brought that information, I believe, to their provider, and they were really open to helping them get that, prescription. So, and learning about it themselves. So you could also educate your provider on this topic too. But there are some really fantastic providers out there who are really knowledgeable that can help you. So awesome. Alexandra, this has been such a good conversation. I wanted to close. Before I do so, is there anything else you'd like to add to the conversation?
I think we covered all of the LDN stuff.
Okay, perfect. Yeah, I think we did too. It was such a great conversation. I think it was a good kind of crash course of like LDN 101 for the audience, and hopefully, providing them with some good information to dig a little bit deeper into this topic. So, just to close, as you know, the Body Ethos podcast is all about helping people shift their lives and ultimately shift our culture from sickness to health. What is one way whoever is listening today can start this journey towards sickness and health?
I would just say that you know your body better than anybody. So listen to that intuition, listen to that internal voice that's telling you, I'm not at my best, my healthiest, and find someone that will listen to you, because that's really the first step. If you feel like you're not being heard by your provider, you don't even have to fire them, but you can just get someone like me as an adjunct that will work alongside your other provider and help you to regain your health and start finding some answers. So just listen to that little voice inside yourself that's telling you that you can find answers, and don't ever give up hope.
Oh, I love that. Absolutely. Yeah. Don't give up hope. Listen to your body. And I think you made a great point. It takes a team. It takes a healing team. You need, not just one provider. You really need a whole team to help you on your healing journey. So find your team, and one that also empowers you. Like I know you do as a provider and I do as a practitioner. So it's awesome. So amen to that. Well, thank you so much for joining us for another episode of the Body Ethos podcast. I hope this conversation with Alexandra inspired you with new insights and expanded your understanding of innovative approaches like low dose naltrexone, LDN, and also empowered you maybe to take some meaningful steps towards health and vibrant healing. If this episode resonated with you, don't keep it to yourself. Please subscribe, share, or leave a review, share it with someone who is ready to shift their health journey. And for more resources, updates, and ways to connect with me or Alexandra, please check out the show notes below. And remember that true healing happens when we get to the root of the issue and reconnect with the wisdom of our mind, body, and spirit. Just as Alexandra said, don't discount what your body is telling you in that story, and listen to that wisdom of your body. Until next time, I hope we stay curious and empowered, and let's just keep shifting that culture from sickness and health together. Thank you so much.